Essential tips for new dentists in dental implant procedures. 1. Comprehensive patient assessment. Before placing any implant, invest the time to fully understand your patient's overall health. Evaluate their bone density and quality using both clinical and radiographic tools. Ask about systemic conditions like diabetes, osteoporosis, or smoking habits, which can slow healing. A careful medical and dental history helps you identify risk factors early, ensuring safer and more predictable treatment outcomes. 2. Advanced imaging for precision. Accurate imaging is the backbone of implant planning. Beyond traditional panoramic radiographs, consider cone beam CT scans for detailed 3D visualization of bone, nerve pathways, and sinus anatomy. These images allow you to measure distances precisely, avoid vital structures, and position implants in a way that supports the planned prosthetic, rather than compromising the prosthetic outcome. 3. Plan from the crown down. Always start with the end in mind. Think about the final restoration, its size, shape, and position before deciding where the implant will go. This reverse planning method ensures that your implant supports ideal aesthetics, proper function, and healthy occlusion, rather than compromising the prosthetic outcome. 4. Maintain strict infection control. Infection control is non-negotiable. Every step, from patient draping to instrument sterilization, must follow strict protocols. Use sterile gloves, drapes, and irrigation fluids during surgery. Remember, contamination can lead to early implant failure, and prevention is far easier than managing post-operative infections. 5. Gentle bone exposure and osteotomy preparation. Treat bone and surrounding tissues with respect. Carefully reflect the flap to expose the bone without tearing or excessive stretching. Prepare the osteotomy site according to manufacturer guidelines, using sharp, well-cooled drills to prevent overheating. This preserves bone vitality and promotes successful osseointegration. 6. Protect vital structures. Know your anatomy and stay alert during surgery. In the mandible, avoid injury to the inferior alveolar nerve and mental foramen. In the maxilla, be mindful of the sinus and nasal floor. A few extra millimeters of caution can prevent life-changing complications like numbness or sinus perforations. 7. Use surgical guides for accuracy. Even skilled surgeons benefit from guides. Whether fabricated digitally or conventionally, surgical guides translate your planning into the patient's mouth with precision. They reduce guesswork, improve angulation, and help you place the implant exactly where you intended in your treatment plan. 8. Clear post-operative instructions. Your job isn't over once the implant is placed. Patients need clear, easy-to-follow instructions, both written and verbal, on controlling bleeding, reducing swelling, managing pain, and cleaning their mouth without disturbing the surgical site. A few minutes of patient education can greatly improve healing outcomes. 9. Medication protocols and compliance. Prescribe antibiotics, anti-inflammatories, and analgesics as appropriate for the case. But remember, prescribing is only half the task. Ensure your patient understands exactly when and how to take their medications, and stress the importance of finishing the course even if they feel better. 10. Consistent follow-up care. Schedule regular follow-up visits to check for early signs of complications and to monitor osseointegration. The first week is critical for soft tissue healing, but long-term stability requires ongoing assessment. Early detection of problems can save an implant that might otherwise be lost. 11. Master head and neck anatomy. A deep knowledge of regional anatomy is your best defense against surgical errors. Study the variations in nerve courses, vascular structures, and bone morphology for each patient. This understanding is not just academic, it's a practical skill that will guide your hand during every procedure. 12. Understand osseointegration. Osseointegration is the biological process that secures the implant in bone. It's influenced by factors such as bone density, implant surface treatment, and whether the implant is loaded immediately or after a healing period. Respecting the biology behind this process is the key to long-term implant survival. 13. Identify complications early. Infections, peri-implantitis, bone loss, and mechanical instability can all threaten an implant's success. Learn to recognize subtle warning signs like persistent pain, swelling, or mobility before they escalate. Early intervention is always more effective than late-stage salvage attempts. 14. Have a management plan and know when to refer. Not every complication can be handled alone. develop clear protocols for managing surgical and prosthetic issues, and build a referral network of specialists you trust. Knowing when to seek help is a mark of professionalism, not weakness. 15. Commit to lifelong learning. Dental implantology evolves rapidly with new materials, techniques, and research emerging every year. Stay current by attending workshops, joining implant societies, and learning from experienced mentors. Your growth as a clinician is a lifelong journey, and every patient benefits when you keep learning.